Well, with the COVID caseload continuing to climb in our region, local hospitals are now having daily discussions about what their capacity looks like and what resources they may be short on.
We looked into what those numbers look like right now. News Channel 9's Julia LeBlanc is joining us now live outside St. Joseph's Hospital. Good morning, Julia. What do we know right now?
Well, we know hospitalization rates are on a steady increase right here in central New York and really across the state. Those numbers are changing, though. We want to mention on a daily, if not an hourly basis. But we do want to give you an idea as those cases start to rise. How much room do we have in our hospitals here? Well, like I said, those numbers are constantly changing, but stick with us. This is a very detailed explanation as we go through this. So as of Tuesday night, 45 coronavirus patients are being treated at St. Joe's right here. 5 are in the intensive care unit, and they can fit a total of 120 total COVID patients between regular and ICU beds. At Upstate Medical, between its community hospital and their downtown location, 84 people are being treated for COVID. 29 are in the ICU. To deal with this situation, Upstate added another COVID unit to each of those locations, so their total capacity is 123 total beds for those COVID patients. Now at CROUSE Hospital, they're treating 39 patients for COVID with 9 people in the ICU. Now they have just 15 beds left there. Finally, at AUBURN Community Hospital, they're treating 7 COVID patients. 1 person is in intensive care, and they only have 3 beds left. Now, each hospital has a plan of its own in case there's a possible surge.
You're still going to have consistent hospitalization numbers in the range we're in now with these caseloads. So we flatten them, we got to bend them if we want these hospital numbers to go down. And if the hospital numbers go down again, I think you'll see some of these restrictions moved.
Now, on top of each of those individual hospital plans, Onondaga County also plans to use the Manley Fieldhouse in case of a possible surge. Now, the problem with that, Onondaga County executive says, is the staffing for that surge hospital. He says at the start of the pandemic, or on the first wave, rather, they were able to exchange resources between upstate and downstate and bring people up or down. Now we're all in the same boat, unfortunately. Live outside St. Joe's, Julia LeBlanc, News Channel 9.